So optometry is a profession that's one of the 3 eye care professions in the United States.
We do eye examinations and look at the state of the health of the eye and the function of the eye.
So we prescribe glasses and contact lenses, and we also provide medical eye care. Here at Ferris State University, Michigan College of Optometry, we have the 2nd smallest program in the country.
My favorite part of this program is the small class size, and we become really close with our teachers.
We have about 38 students in each class.
So because we have a smaller class size, every student gets to benefit from all the facilities we have here in our new building that opened in 2011. Every student gets to benefit from personalized attention from members of the faculty and the staff. And we really have more of a family feel here at the college.
In their first year, that's mostly just laboratory work and classroom work. And they do start to learn how to do various procedures, get their hands on the equipment and learn how to use it. In the second year, they get much more advanced and learning more about the eye itself. And finally, my position as being the assistant dean for clinical education is that they will get into the clinic and actually start seeing patients here.
What I like most about optometry school here at Michigan College of Optometry is the clinic experience that you are able to get and see on your patients or your students or your classmates here.
Right now we're taking an optics class. Optics obviously has to do with how light works and how it works in the eyes. And we are taking procedures, which we learn all of the different kind of procedures for to do an eye exam.
We have a number of courses throughout the 4 years of the curriculum where students come together and with a faculty member, and they talk about a case, either a case that illustrates a specific disease condition like diabetes and how that's managed, or a case that's more complicated later on that involves a number of different factors creating difficulty in treating a patient in one way or another.
Well, I could see 2 advantages that the Michigan College of Optometry has in educating optometric students anyway, and one of them is our wonderful brand new clinical facility. And if anybody were to come here, and we have people that come from other colleges of optometry and visit our campus, and they are just, of course, amazed at the facility that we have here because it's relatively new. And it was built from the ground up to be the premier institution for teaching an optometric student.
Well, healthcare is also becoming increasingly technology-based. So we feel it's important for students to have access to the newest technology in eye and vision care so that they know how to incorporate that technology into the care of their patients.
We have this brand new building and it's all state-of-the-art equipment with beautiful new instruments that they have and all high-tech technology. And the cool thing is you just get to use it. You get to be introduced to it. You get to learn straight up what's the newest and most innovative ways in optometry right now.
My favorite aspect would probably be, the hands-on stuff, actually. Trying things out for myself. What we're talking about in class, that's great, learning it in the books, but actually doing it is a whole other thing. That's the way I like to learn the best anyway.
It's one thing to know how to use the technology. It's another thing to be able to use that technology and integrate it in the care of the patient. When a lot of patients, they're impressed by technology, but they're also a little scared of it. And so, it's the doctor's job to explain things, to communicate very well, and to use the findings from that technology to really partner with the patient in that patient's care.
The Michigan College of Optometry's model for clinical education is that then we will send them out away from the building here. We keep a couple of what we call 4th-year students here, but most of them are gone all across the country in the state of Michigan, working in the VA systems or other practices and things like that, and learning about more clinical education. And at that time, really all about they're doing is working almost 40 hours a week in a clinic.
If you go and tour other schools, you won't get anything like they have here at Ferris. As far as integrating you into MCO, they have a beautiful pre-optometry plan. They have classes. They have a whole degree for pre-optometry, which is great and far superior than you would have at other colleges. So as far as kind of getting you in the door, they do a great job, and they kind of introduce you to the building. You have opportunities to volunteer here at MCO while you're an undergrad and kind of see the doctors, see the faculty here. You meet older and upperclassmen that are in the optometry school already, and you kind of relate to them. You can bounce ideas off of them, and overall it's just a great experience to be at Ferris for your undergrad if you're planning to go to optometry school here.